My name is Nicole. What motivated me to pursue speech and language pathology was growing up and seeing my parents, who learned English as a second language, seeing them experience communication breakdowns, and it had a really big impact on their self-esteem and their ability to navigate different scenarios. So looking at our kiddos who have communication disorders, I could really empathize with them, not completely, but I felt like I've seen a glimpse of what that can look like and feel like. So I wanted to be part of helping them navigate those communication breakdowns and learning new skills so they can be understood and experience that aha moment where someone understands what I'm saying. When you feel understood by someone, it is the biggest sense of relief when you're kind of grasping for someone to look at you and acknowledge the message that you're trying to communicate. Maybe you yourself don't even know what you're trying to communicate, and you have that person or that situation in which you think, they know what I mean. I love being able to curate moments that allow a kiddo to explore their communication skills, build stronger skills, so we can get more and more of those moments, because that's what life is about, is trying to understand others and experience feeling understood and feeling like you belong. So my favorite part about my role is getting to support those skills. Working at ACP gives me the ability to work with the population that I most enjoy working with in terms of age and diagnoses. I love working on early language development, and I have to say that knowing I was going to have access to the VIS and be fully trained as a VIS clinician really sold me. Learning more about what the VIS is as a framework and seeing examples of how much it has helped kids comprehend following directions or expressing more complex messages, it's so powerful, and I was really excited to know that I would have access to that in my sessions. I am a big fan of giving really specific feedback as to what someone has done or said that I ended up finding really helpful in a session, especially when it comes to collaborating with OT and BCBAs. They have so much insight in their individual roles that they end up sharing with me in passing, or whether it's a formal collaboration meeting or a quick conversation in the hallway. So I always try to loop back around and say, hey, that conversation we had a couple days ago ended up being so helpful because I got to do XYZ in my session and it worked. So I always like to be really explicit in who helped me and how, and that fosters really great communication going forward. My favorite way to collaborate with families is to invite them directly to come to sessions. It's a great opportunity for me to ask them, what are your child's favorite things? What are your child's biggest challenges from your perspective? Because I want to know what's going on at home. I can assess a child here and talk about their strengths and weaknesses in this setting, but it's the parent interviews, the collaboration that really helps you understand the whole child. I think our BTs are unlike any other BTs. I'm biased, but they're fabulous, magical people. You can tell how much they love these kids, how playful they are with them, how patient they are, and their energy is really infectious. When you walk into the Holyoke Center, you feel like everyone is already your friend. First, I make sure that I've really assessed their receptive language or their language comprehension. A lot of the times, kiddos might be very verbal or vocal, and so we just assume that the child is understanding all the language that we're throwing at them, but oftentimes a child may be vocal or verbal, and they're having a really hard time following directions. It can be easy to interpret that as a behavior, maybe as obstinance or defiance or ignoring, but a lot of kiddos have receptive language deficits, so it's important to address that first and do a lot of explicit teaching of what language means, regardless of how chatty they may appear. I think that inclusion really resonates with me the most. Life can be very isolating for all of us for very different reasons, but when you've got some behavioral challenges, difficulty with regulation, finding gross motor challenges, a communication impairment, it is really hard to feel included, and our world isn't designed to include people who have those kinds of challenges. So seeing how easy it is for kids here to find a place where they belong where the toys and the space is set up for them to enjoy and play in the way that feels right for them. Stacking and lining things up. It doesn't matter what play is functional, play is play, so they get to play the way that makes them happy. That is what resonates with me the most, and seeing that every day with all of the providers too. Seeing how they really affirm the needs and the preferences of these kiddos is really empowering, and I think is a beautiful example of inclusion. My onboarding and training process was lovely. I did not feel like I was drinking from a fire hose. I felt like everything was really nicely paced, and there was clear organization as to what had to be done, in which order, in order to build upon competencies. My supervisor, she actually made a really long drive just to come here and be with me in person on my first day. And I felt like I had a lot of people I could turn to ask questions while I was completing things on my own time. I think I just need to shout out my supervisor for being such a comprehensive and helpful leader. She's great. I found it so reassuring that ACP and she as an individual really wanted me to know my stuff. And they weren't going to start me with a full caseload the first week, because for them it was really important that I understood the ins and outs of how we do things and why, so that way once you've hit the ground running, you can really just focus on your relationship with the kids, because they value the time that's being put into training you. So my supervisor is fantastic. It is nice feeling like I can answer some of the questions on my own now and feeling that increased confidence as you're learning the ropes. But I know that I can send a quick Teams message to my supervisor at any point in the day, and I'm really confident that I will have an answer soon enough in order to keep all the processes going. And even if it's somebody who isn't a direct supervisor or even on the speech team, I know I can go to my family liaison, our clinical director, the BCBAs. Everyone just has all hands on deck and is ready to help you. It is rare to find that in a workplace where anyone is willing to at least try to help you find a solution.